Hello, today I'm going to talk about the challenges to implementing U equals U and how to overcome them. And these aren't the challenges to the science, because I think there's a lot of support and resources out there about the science and verifying that the U equals U science is true. This is more about, what we've learned from the many different organizations now in 102 countries who are working hard to get the U equals U message out to people with HIV, to providers, to policymakers, and the public. These are the things that many of us have faced, and here's how we overcome them. So first, it's just the incredible amount of misinformation, outdated information from the 80s, and stigmatizing messages that are coming out and that are really causing people to be misinformed about HIV and people with HIV. The lack of authority, so feeling like they don't have permission to share the message. Maybe their people's health ministries aren't saying U equals U or any related message. Paternalism and fear of change. Now, this is just about human behavior. These are really challenging, but I think that we found some ways to overcome both of these challenges to U equals U. So first, overcoming the misinformation. So where do people get their information? Well, we know people Google, and that's where they find information about HIV. What is HIV? Can I get HIV? Am I infectious? How do I protect myself? All these sort of things on websites, and many of them are out of date. In fact, in the United States, we did a survey of 100 nonprofit organizations, and only 7 of them had updated U equals U information or related phrase prominent on their websites anywhere at all. Community, we learn from our peers and we learn from our families, and that's social learning theory. Media and pop culture, informal education is incredibly powerful. And not so much sexual health education, because it doesn't seem to be happening that much. In the United States, we did a study called Owning HIV, which showed 40% of America's youngest population, 18 to 22, said they were not at all informed or only somewhat informed about HIV. So that's not happening so much anymore. Now, we can overcome misinformation with information. Good information, engaging visuals, putting the information about U equals U and HIV transmission up front, because this is new, it's still radical information, and people need to hear it over and over again in order to really accept that it's true. So it needs to be up front, it needs to be bold. Also, people need to see U equals U shared from the same people that look like them. So the messenger is really important. Here's some examples of U equals U visuals, videos on organizations from Italy on the left, from Lila, K equals K in Vietnam, HIV Japan on the top right, and AIDS United in the United States. And also, we've got to really monitor the media, because as I was saying, popular culture is a powerful educator. Informal education is really key to changing perceptions of HIV and people with HIV. So there was a recent series on Twitter called 13 Reasons Why, which showed a very stigmatizing, unrealistic portrayal of someone living with HIV. And that was corrected immediately. Terrence Higgins Trust took to social media to say this is not okay. This is not what HIV is today. Similarly, there was a horribly stigmatizing show on Netflix, HIV 101, that just completely ignored all the developments of HIV today, including U equals U and PrEP, and showed dying babies and then healthy babies to sort of scare people that HIV is coming for your baby. I mean, it was terrifying, and that needed to be addressed. And then also, we can use popular culture for good. Gareth Thomas coming out in the UK and British HIV Association working with him to make sure his message is heard. U equals U, I'm HIV positive and I'm going to live and I can't pass it on. Same thing with Jonathan Van Ness in the United States, a celebrity in the US. And when It's a Sin show came out, Terrence Higgins Trust again and a lot of the agencies in the UK took this as an opportunity to educate on a massive scale, and it was a huge hit. HIV Ireland created this really excellent media guide to help us train reporters, train journalists so that we can combat the misinformation in the media. And really, it's about getting the word out, just creating campaigns that are meeting people where they're at, reaching every key affected population. England is like Disney World for campaigns. There are so many Can't Pass It On and U=U campaigns in England. And around the world, there are wonderful campaigns that are addressing, again, every key affected population. There's K=K in Vietnam, I=I in Spain and Portugal and Brazil, H=H in Russia, N=N in Germany and the Netherlands, B=B in Turkey. I could go on and on and on. But finding ways to get this message out that are relevant and meaningful for the population you serve is so important. We can overcome misinformation with correct information. And then overcoming lack of authority. So folks feel like they can't say U=U because they don't have the support from high-level institutions, or they don't have the permission, and they don't know how to say U=U. So there's a lot of support for this. At the very highest levels, the WHO is supporting U=U. PEPFAR is supporting U=U. It's actually a minimum requirement of all 50 countries. And guidelines are really important. This is something that my team and I are really working on, is to make sure guidelines are updated country by country. So the United States updated their treatment guidelines to include U=U in 2019. And then the CDC in the US gave us permission to use U=U, to use other phrases that we don't actually have to follow the exact language of the CDC in the United States to convey this message. We can convey it in ways that really work for the communities we serve. And they urged it. So these two documents are really important in the United States. We've seen also things like this in Brazil and Vietnam and Zambia. And overcoming lack of authority, again, it's sort of about this fear that we can't figure out. I mean, this is new information. How do we talk about U=U? We need to know how, because it's radical, because it's new. There's a CDC toolkit. There's online trainings and lots of different resources on our websites, trainings, guidance for providers that can then help folks understand how to communicate it. That's something that I do, every other day, is help folks communicate U=U. So happy to get in touch. And overcoming the paternalism. This is the human nature part of it that I think is the most challenging. And we have some techniques to get around this. So one thing we always hear is, we're going to tell U=U to patients who will understand it the most, the sophisticated consumers. And that we're going to withhold U=U because there's already a rise of other STIs. Well, no one gives healthcare providers a right to make these decisions for us about our bodies. And these decisions are often made through prejudice and racism and all forms of isms and sex negativity. And that's not okay. People with HIV demand and deserve accurate information about our sexual, social, and reproductive health. And this violates the people-centered approaches, that best practices, and our bodily autonomy of people with HIV. So this is all wrong. And the ways that we can overcome this are appealing to the self-interest of the paternalist person. And often this is coming from, they're concerned about their patients and they feel they're doing the right thing, but the right thing is to give us information and to decide for us. So appealing to the self-interest. There will be wasted opportunities to improve your patient's health and public health if you're not sharing this message, because there's data that shows when healthcare providers talk to people with HIV about U=U, they're reporting greater adherence, greater virological control, mental health, sexual health, overall health, all these wonderful things. And we know the more people who are on treatment, the fewer new transmissions there'll be. And this is a real issue, that patients are finding out about U=U elsewhere, and they're going to their doctors and they're saying, why didn't you tell me this? And they're getting mad, and they're stopping going to their doctors if they have the luxury, or there's a mistrust between doctor and patient. We know that's incredibly damaging for engagement in care, that mistrust. So this sometimes helps folks to rethink their approaches to gatekeeping with their patients. It kind of shakes them out of their old ways. And then peer pressure is really important. So hearing clinicians and other healthcare providers, hearing from other healthcare providers, and from the places that they look to for guidance. So Sarah Calabrese, who's I know is speaking at this forum as well, has written already 2 really strong articles about why providers should discuss U equals U with their patients. So it's really about peer pressure, doctor to doctor, healthcare provider to healthcare provider. Fear of change is just natural. And, this is just about like U equals U is radical. It goes against 40 years of what we thought we knew about HIV and people with HIV. And that there's that discomfort between old ways and new ways of thinking, and that's called cognitive dissonance. And it's really about understanding cognitive dissonance, how to work with someone who's experiencing that, because often folks who are in that state will choose data to reinforce their pre-existing beliefs, even if it's bad for them. They'll look away from information that's good for them and their community because they're attached to their old ways of thinking. And so you've got to name that and kind of walk through them with that. Understand what cognitive dissonance is. Is this your feeling or is this your fact? Or this is the facts. Well, here's the facts. Let's borrow confidence from the experts. It's uncomfortable for you, but the experts are confident. You're not an expert in transmission risk. Neither am I. I don't study it, but let's look to the experts who do. And then finally, let's consider the pros and cons of sharing this information. Do we want to improve our patients' health? Do we want to improve public health and move towards ending the epidemic? Or look what's going to happen if we don't share this information. We'll be falling behind. This will be breaking trust between you and your patient and wasting opportunities to improve their lives. So finally, in summary, how do we overcome these challenges? And we are overcoming them all around the world. Just make sure we get the information out first. The best thing is to make sure it's accurate, make sure it's front and center. Again, don't hide it in your speech and mumble when you mention it, along with U equals with PrEP and PEP. U equals U needs to stand alone because it's so new and radical. Make it front and center. Monitor and correct information online. This takes a lot of time. We do this all the time at my organization, and we just got to keep doing it. And this is really important. This is a major goal that we're working on, and it's really country by country, is to make sure that the leading health authorities and the organizations in those countries who have influence are encouraging folks and giving them guidance on how to say U equals U. And finally, it's human nature. Change is slow. U equals U is innovation. It's still a radical challenge to the status quo. So it's important to, and I know I tell myself this all the time, is to remind yourself that this is happening, and it's happened remarkably fast throughout the world. This has spread remarkably fast. And at the same time, there are still serious resistance and challenges to getting this message out, and that does take time, and we just have to keep going. We can't give up. So I want to thank you so much for listening today and for being part of this revolution and what it means to love and live with HIV around the world. And you can get in touch with me. Here is my email and our website. We're here to support you in getting this message out and overcoming the challenges to getting this message out that we are facing as a U equals U community who care about people with HIV around the world. Thank you.